Hi, Mr. Hay. My name is Paula. I'm going to be your nurse today. I'm going to be doing a physical head-to-toe assessment on you. I'm just asking for your consent. Do you give me consent to do this?
Sure.
Thank you so much. I've washed my hand and I have assessed the patient's vital signs. Everything is within normal limits. I'm going to start by assessing the patient's skin, starting from the arm and the leg. I'm going to assess the skin color for any irregularities. I'm going to assess the skin thickness. I'm going to assess skin turgor to check for dehydration. I'm going to assess the leg too. After that, I'll move to the nails, check for size, shape, irregularities in the color. Check the nails on the finger, check the nails on the leg. Okay, and everything looks good. I'm gonna assess the patient's hair for hair distribution and texture, and everything looks awesome. Next, I'll move to the patient's neck. I will assess the neck for any discoloration, any changes. I'm gonna assess the temporal artery. I'll first palpate and auscultate, okay? You can feel them on both sides, and I'm gonna auscultate. With my diaphragm. Okay. Gonna assess the frontal sinus. Do you have any pain or pressure?
No.
Okay. And the maxillary sinus right there. Any pain or pressure?
No.
Great. I'm gonna assess the patient's lymph nodes, okay, of the head, of the clavicle, which is around this area, okay, and the axillary right behind in the armpit. I'm gonna assess the patient TMJ, the joint here, by having the patient to open and close his mouth. Okay, open and close. Great. I'm gonna go behind the patient's neck and assess for his thyroid gland. Okay. Okay. Gonna assess the carotid artery. Gonna palpate for it and also auscultate on both sides. We're going to move to the patient's eyes. I will assess the external eyes, and everything looks good. I'm going to palpate the upper eyelid and the lower. Okay, do you have any pain?
No.
Okay. All right. I'm gonna check the patient's extraocular movements with my finger. I will ask the patient to follow the movement of my finger. Okay, Mr. Hay, can you go with my finger? Thank you. Good. Very good. Okay, the extraocular movements. I'm gonna assess the patient's optic disc with the use of my ophthalmoscope. Shine the light into the patient's eyes. Open your eyes wide for me. Okay. I'm also gonna assess the patient's pupillary reflex with the use of my pen lights. I will do it on individual eyes. Okay. And I'll do it this way. Great. I am going to assess. We do not have a Snelling chart here, or a Snelling chart is used to test the patient vision acuity. We'll have the patient to stand 20 meters away from the chart, and the patient will read the letters he can read. Okay. I think I assessed the optic disc. I assessed the peripheral vision. Okay, and I'll move to the here. I'll start by assessing the external here on both sides. Okay, with the use of my otoscope, I will assess the tympanic membrane. Okay, it's shining, no bulginess. Do the same on this side. Okay, very good. No redness, no bulginess noted. I am gonna do some hearing tests, starting with the whisper test. I'm gonna stand behind the patient and whisper some numbers.
99. 99.
Patient is able to answer the whisper test. I'm gonna do 2 different hearing tests on the patient. The first one is the Rhine test and the Weber test. The Rhine test tests the ear conduction versus bone conduction. Gonna use the tuning fork by packing it on my nail cap. Which one can you hear? A or B?
B.
Okay. Do the same on the other side. A or B?
B.
I'm gonna check for the Weber test by putting the tuning fork in the middle, in the center part of the patient's head. Where can you hear?
Center.
Left side or center?
Center.
Okay. I'm gonna move ahead and check the nose. I check the nose like that. And I'll have the patient smell something for me to check the sense of smell. Close your eyes, please. What can you smell?
Lip balm.
Lip balm. Okay. With my otoscope, I'll check the internal nose side by side. I'm gonna raise your head up. Okay. Okay. I'm gonna go ahead and check the throat. I'll have the patient open his mouth. Can you open your mouth? Can you raise your tongue up, side, the other side? Very good. I'm gonna check the patient's gag reflex with the use of my tongue. Gag reflex is present. And I'm gonna use my otoscope to assess the internal, the mucosal membrane. Okay, open up. The mucosal membrane is moist and red. Okay. No open wounds noted. Perfect. So I'm gonna move ahead and assess the cardiac system of the patient. I'm gonna start by assessing the jugular vein distension, which is on the right side. I'm just gonna assess. Okay, right. And I will assess the various pulses the patient has at various parts of the body. I'll start with the PMI on the left side. Okay, start with the PMI, the carotid pulse on both sides. Okay, the brachial pulse is right at the elbow. Now assess on both sides. The radial pulse is right there, around the wrist. assess both sides. The femoral pulse is around the groin area. The popliteal pulse is behind the nails. Okay. Yep, that's fine. The posterior tibial is around the ankle area. And the dorsal pedalis is on the foot. Okay. I'll go ahead and listen to different the S1 and S2, the heart sound at different points. I'll start with the aortic. I'm gonna have the patient lay down. The aortic is on the right second intercostal space. I'm gonna look for that. 1 and 2. I'm trying to look for the S1 and the S2 sound. Yep, you can hear that. And I'm gonna change. This is the diaphragm. I'm gonna use a bell to listen. Okay, I'm gonna go to the opposite side on the left second intercostal space where we have the pulmonic. Okay. The head point is right below on the third left intercostal space. The tricuspid is on the fourth intercostal space, fourth left intercostal space, and the mitral is on the fifth left intercostal space. While the patient is still laying down, I will assess for arteries. I'll start with my aortic artery. And I can hear it right there. I will assess my left and right kidney arteries. The iliac artery is right below, left and right. The femoral artery is in the groin area. I will have my patient sit up and check for capillary refills on the fingers and the toe. Has to be the blood refill should be less than 2 seconds on each fingers. Capillary refill present. Okay. I'll move ahead to check the respiratory system. I'll start by assessing the chest for expansion. I'll have the patient take deep breath. Take a deep breath. Good. Breathe. Very good. Okay. I'll assess for fermeters. I'll go ahead and check the pulse and the oxygen saturation by placing my oximeter on the patient's finger. Patient is 97% on room here, and pulse is 62 beats per minute. I will auscultate the long sound, there are 6 points in the front, while there are 10 points at the back. Okay, I'm gonna start from the front. Take a deep breath, in and out, out, in and 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 out. I'm gonna repeat the same while patient is saying 99. Okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Same in the front while patient is saying 99.
99, 99, 99, 99, 99, 99.
I'm gonna percuss, do some percussion. Okay. With that, we completed the respiratory system, and I'll move ahead to the gastrointestinal system. First of all, I'll have the patient lay down again. Gonna just assess the abdominal area. The order is to assess first, auscultate, percussion, and palpation. So I'm going to assess the different quadrants in the abdominal area. We have 4 different quadrants, and I'll start from the right lower quadrant, and I'll move clockwise. I've assessed the abdominal area. I'm gonna percuse the quadrant in a zigzag form. Okay. After that, I will do some light palpation on the quadrant. The light one just go with you just go like about 1 centimeter. That's a light palpation. Any pain?
No.
No pain?
No.
Any pain?
No.
Deep palpation, you tend to go more with your arm, and go about 4 to 5 centimeters. Do you have any pain?
No.
In this area, we can palpate the liver in this area. The spine is right there. To palpate the kidney, the patient has to sit up. The kidney is right at the back, so to palpate the kidney, I have to go this way. And lastly, I will percuse for CVA, which is around the 12th rib at the back. Okay, and with that, we completed our GI system. I'll move ahead and assess the musculoskeletal system by assessing the joints of the neck, of the shoulder, the elbow, the arm, the wrist, finger, the hip, the nail, the foot, and the toes. I'm gonna give patients some instructions to follow. Can you flex your neck backward? Okay. All right, go back and forward. Good. Can you do your neck side to side, ear to shoulder? Very good. And I'm gonna test the strength of your neck. Okay, triangle. Yeah. Let's do the same to the back. Okay, very good. I'm gonna assess the patient's shoulder. Gonna have the patient flex his arm. Okay. Flexation, extension goes to the back, and abduction goes this way, and adduction goes this way. We do the same for this side, to the back, there, and there. Can you go again, shrug your shoulder? Very good. I'll go ahead and assess the elbow for flexion and extension. Okay. Very good. I'm gonna assess the arm, the wrists, flexion, extension, abduction, supination, pronation. Can you coil your fingers? Okay. Can you give me a strong grip? Very good. I'm gonna have you stand up while we assess the spine area. Okay. Can you move laterally? Can you bend? Very good. Can you go backward? Very good. Can you do some rotation for me? Very good. Awesome. Thank you. Lay down and I'll assess your hip. Flexion. Adduction. Flexion. Adduction. We're gonna switch backwards so I can assess your extension. Extension of the hip. Very good. Extension. Very good. Can you sit up for me? We do the same for the nail, or for the nail. Okay. Okay. For the ankle, flexion, extension, abduction. Do the same for the other. Can you coil your? Okay. Resistance. Very good. Okay. Can you do the same for up here? Very good. Okay. With that, we completed the musculoskeletal system, and we'll move straight to the cranial nerves. The cranial nerves 7. By having the patients, cranial nerve 7, by having the patient raise the eyebrows. Can you raise your eyebrows for me? Can you frown for me, like you're mad at me? Can you close your eyes tightly? Very good. And smile for me. Very good. move to the other cranial nerve. And this test 11, 10, and 12. And I'll have you open your mouth. Say ha.
Ha.
Stick your tongue out. Very good. And that completes that. I will assess your motor skills. I will assess your motor skills by having you run your heels to your shin, heels to shin. On the other side, heels to shin. Can you close your eyes? Finger to nose. On the other side, finger to nose. Can you stand up and walk across this room? Okay, can you do heels to toes? Yeah, walk across the room, heel to toes. Very good. And can you walk on your heels? Don't fall. Okay, turn around. Can you walk on your toes? Yep. Great. Can you give me some rapid alternate movement? Great. Have your seat. And one thing I forgot to assess is the reflex action with the use of my reflex armor. It's supposed to assess your biceps, triceps, brachial, the patella, and Achilles. With the brachial, I'm gonna have the patient relax, and good. The triceps, we assess it from the back. Okay. The brachial, we assess this area. Very good. The patella, we assess on the nail cap. So it goes below the nail cap. You want to make sure the patient's feet are dangling. Good. In the Achilles, we go to the back of the leg. Okay. With that, we complete our test, and I'll go ahead and assess the psych parts of this. Oh, no, actually, I have to test for two other different things. I'll test for the grief. I'll test the patient by having him close his eyes and open your palms for me. That's the Gastrointestinal test. Okay, I'm gonna write an alphabet, and I want you to tell me what I wrote.
A. A.
Okay, that is our Gastrointestinal test. I'm gonna test the stenosis. Test for stenosis. I'm gonna put something in your palm, and I want you to tell me what it is.
This is a coin.
On the other hand,
this is a pen.
very good. Thank you so much. I didn't test for facial sensation. I'm gonna test the facial sensation. Can you close your eyes? Is this sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
I'm supposed to test it on the arm and legs too. Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
On the leg? Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Thank you. Gonna assess the patient's psych. I'm gonna open your eyes. Who is the President of the United States?
President Donald Trump.
What year are we? Right.
We're in 2019. 2019.
And where are you right now?
I'm in Taunton, Massachusetts.
Thank you. So the patient is allowed to person, place, and time, knows what is going on. I'm gonna test his short-term memory by asking him, how did you spend your last birthday?
Last birthday, I had fun with my family. We went out to a Chinese restaurant and we all had fun together.
That's good. And I'm also gonna have you count backward from 100 in 7 in 1 minute. If you can do that, that would be great.
100, 93, 86,
Yep.
79,
Yes.
72,
Yep.
65, 58, 51,
Yep.
44,
Great.
37, 30,
Yep.
23,
Yes.
16,
Yes.
9, 2.
Thank you. I'm gonna give you this piece of paper. I want you to read and follow instruction. So the paper, can we just read out? It says take
Paper in left hand, fold it in half, and place it on the floor.
Thank you. And now I'm gonna be giving you 3 words. The 3 words are red. They are car, dress, and red. I want you to count backward from 20. Can you?
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
That's great. Can you repeat the 3 words I gave to you?
Car, red, car, dress, red.
Thank you. It was really awesome doing this assessment with you. Thank you for your time.
You're welcome.
And I hope you have a great day.
Thank you, and you too.